So healthcare is actually a highly confusing topic. I get questions on it all the time. And one of the reasons that it's so confusing is that the prices are not publicly available anymore. And the complexity that we've put into pricing healthcare services has way overdone what it used to be. Because of this, we need to include price transparency. Price transparency is going to help us in understanding exactly what we are paying for, pay correctly, and increase the market. So first, let's start off with a roadmap of exactly where we're going and what we're going to be doing when we're talking today. What we're first going to cover is what is price transparency. Next, we'll move on to why is this an important thing for us to cover and consider. Third, we're going to move on to what are the benefits of establishing a system. And then fourth, we'll go ahead and discuss a type of system that can be implemented. It's just one of many different types. So let's start with what is transparency. Now, what we have here is something that I hope we are all familiar with, a McDonald's menu. Now, if you rolled up to McDonald's and you decided that you wanted to be in a textbook and decided to place an order like this and ordered 56 cheeseburgers, 80 chicken McNuggets, and 120 large fries, congratulations, you just entered my algebra book. But you've also just placed a very large order. You're expecting them to respond back with a total. But if they instead responded back with, they need to know your age, they need to know your gender, they need to know the number of times that you visit within a week. And after they have all of that information, they'll go ahead and give you a total after you finish eating your order so that they can ensure that you pay for it.
I'm sorry, I motioned and you thought I meant for you to talk louder.
Mm-hmm.
And I was just saying good job.
Oh.
With the introduction. So, sorry about that.
You might respond with, what? You're not going to pay for services after receiving them. You want to quote before you receive them because you need to know what you're going to owe. By not knowing what you're going to owe, that's how you go into debt. This is what price transparency is. Price transparency is the idea that before services are rendered or before you receive a service, you know what it's going to cost. And that is not the standard used for healthcare. Healthcare, it's a gamble. You go into the hospital, you're going to need the services no matter what, but different hospitals pay at different rates. There are at least 14 procedure codes that can all mean something very similar with just a small change between the two. Let me tell you, I process claims for a living. Providers can switch with whatever they want and suddenly suddenly charge you 3 times more than they would have charged you before just by changing one number. So why is this important? Well, we have 3 people here. Let's call them Sherry, Shirley, and Susie. Sherry, Shirley, and Susie all are going to be transported to the hospital closest to them during a time of an emergency. Upon entering these hospitals, they're going to be charged 3 completely different rates. And it has absolutely nothing to do with where they were located, with what they're getting done. They can all 3 get the same service done, but because of where they were located when they had their emergency, their closest hospital pays at a different rate than their local. Here's an example of that. These are all hospitals located close to one another. For pacemaker services, Livingston, New Jersey charged $70,712, whereas Ronway charged $101,945 for the exact same service. There's gallbladder removal, something that has to be done if you're having gallbladder issues. $40,000 from St. Augustine. But you go to Orange Park, Florida, it's $91,000, over doubled. Pneumonia treatment, also well over doubled. And then we have joint replacement. Now, these are actually really interesting. For example, University of Kansas or Hospital of the University of Southern California, they get away with charging extra rates. Why? Because they're a learning facility. They need extra supervision for the students to feel safe and for you to feel safe under a medical student's care. Because let's face it, they don't know what they're doing yet. So they bill you for this extra service by charging you $123,885, 6 times more than the national average for this service. Hospital Catalina Hospital, $220,811. You think this is bad now? 20 years within our lifetime, these prices are expected to go up by 80%. 85% if you want to get very technical. That's what this will look like at that time. There are your price differences. If we increase these prices by 85% for a simple joint replacement, that's $408,629.85. So, first issue. Pricing differences. You don't know when you're going into the hospital exactly what you're going to get. Consumer blindness. The best way I can explain this is if I were to blindfold one of you and send you into a department store, tell you that you're required to pick up 3 items. You are in need of 3 items, and you pick up 3 random items off the shelf and walk back out with your purchases. Then, a month later, I go ahead and send you an explanation of benefits for the items that you've received. I've charged you $1,199.99 for 3 items that you picked up off the shelf blindfolded. You didn't have a choice in what you picked up. You couldn't see. Now, in order to better explain how this affects you, I'm going to do some quick math on the board. Now, there are 2 ways that this can affect you. We're going to go ahead and start with the way that it affects an insured. Now, for an insured, what you generally have for payments on your policies is we'll start with a deductible. Most people now face a high deductible plan. That's going to put you somewhere around $8,000 out of pocket for your deductible to start off with. This means you owe this 100% before your insurance will pick up and pay anything. Following that $8,000, we have what's called a coinsurance, abbreviated COIN. Now, this coinsurance depends on where you're located at the time and the company that you're invested in. We're going to do Blue Cross of Kansas City because that's the closest. They normally do an 80-20% coinsurance rate. That means they're going to pay for 80% of charges while you pay for 20% of charges. This will continue until you reach your out-of-pocket maximum. Get this. Normal out-of-pocket maximum nowadays, for a family of 4, $80,000. That means you will continue to pay on this policy until you hit that $80,000 range. Now, let's go ahead and take one of these services. I'm going to go back 2 slides, and we're going to take nowadays charges. So, $14,106 will be in Dallas, Texas with pneumonia. Minus $8,000 from that. You'll owe that $8,000 up front for your deductible. You've now met your deductible. You have $6,160 remaining. You're going to pay 20% of these charges. $1,232. Plus the $8,000 you originally paid, $9,232 because you had pneumonia. And that's just now. Come future, it'll increase. Out-of-pockets will increase as well. That is consumer blindness. Finally, we have price gouging. Now, the most obvious place where price gouging occurs is medications. Price for Dopamine. Now, dopamine is used to treat life-threatening infections, malaria, and then is used as a supplement for those with AIDS to increase their immune support. It costs $1 to make 1 pill. Originally, they were charging $13.50 for this. Then overnight, there was a company takeover. Another pharmaceutical company took over this company and overnight increased it to $750 per pill. Because these pills were required by those with AIDS in order to live. So they knew that no matter what they charged, they were going to get their money. They are making a $749, 49% profit off of each and every pill. Cyclosine. Now, this is used to treat tuberculosis. In other countries, they only charge 22 cents a pill and still make money off of it. But in the United States, it was $500 for 30 pills. Then, after a company takeover, it's $10,800 for 30 pills. Now, keep in mind, this is just the United States. All other countries, 22 cents a pill. So, other news, Harvard Medical School. Generic versus your name brand. Basically the same thing. The amount of the chemicals in the pill changes a little, but not enough to make the effect dampen to the point where it's no longer effective. Generic cost $200, name brand $11,000 a pill. For a pill that prevents preterm babies, preemies. So, what are the benefits of establishing this system? First, we have competitive pricing. Now, capitalism naturally picks up where capitalism is. As soon as you put the prices out there and make the companies compete with one another and the hospitals compete with one another, you're going to find that prices are going to start dropping. Walgreens versus CVS. They're charging you for the same things, but their prices are different. They're competing with one another. They're not looking to make a 749% profit. They're looking to make a profit while competing within the free market. Next, we have innovation and creation. Now, what free market inspires is the idea that if I can do it cheaper and better, I'm going to sell more of them. By performing these services cheaper and better, we're going to provide innovation. We're going to create new types of healthcare. We're going to help people live longer because suddenly there's money in it. Because in capitalism, if there's not money in it, we're not interested. So, how can we do this? Is this even possible? You'd be surprised to know that it's going to have to start with the insurance companies. The insurance companies have access to your contracts, but not just your contracts. What you don't know is when your claims get priced, every single provider has a contract as well that they pay off of. That's what I do for a living. I pay claims. So, if I process for one provider, they're going to charge you $1,000 for that service because that's what it's covered at. I process for another provider, that same service now costs $5,000. I do it on the daily. You'd be surprised to know that most systems like Facets, QNX, and Mainframe, which are claims processing systems, have capabilities to communicate with the web. We can set a link up so that it feeds to the web, just like the web feeds to it. When you enter your information online, it feeds directly into this system and generates you a profile. It can work in reverse as well. We can do an estimate on how much a claim will cost. It's not hard, it's just not set up. This will cause the providers to have to do full disclosure of what they're billing as well. You might be surprised what you see on a claim from a provider that they didn't actually do. They charge you for a code that bills 30 minutes when they only saw you for 15. With this full disclosure, we're going to decrease fraud. The patient will know exactly what the provider is claiming to have done for them, and it'll encourage more honest billing, which will drop prices. As provider fraud goes down, so do provider charges. Remember, we are the power. The power of the people is greater than the people in power. That's one of my favorite quotes. If we put pressure on these providers, that's exactly what's going to happen. They're standing out on a ledge. If we step off, they have nowhere to go. So, what did we discuss today? We discussed what is price transparency. We also discussed why price transparency is important. We then discussed the benefits of establishing a system that includes price transparency for the consumer. And finally, we discussed the idea that price transparency can be done simply through the insurance providers. So, price transparency, a way of the future, and hopefully a solution to our healthcare issue. For anybody that needs it, this is my content sources. these are my picture sources. I didn't get time to actually do the pictures.